Hi there, I'm Jennifer Hefner, Superintendent of the Alexander County School System, and with me today we have Leanne Wisnett, Executive Director at the Alexander County Health Department. We wanted to just talk to you today about a recent decision that was made by the Alexander County Board of Education, and that decision was made on October 13th at a Board of Education meeting. At the meeting, it was decided that our students in grades pre-K through second grade will return to the classroom for face-to-face learning on October 26th. Now, what that means is that students will come face-to-face 4 days each week, Monday, Tuesday, Thursday, and Friday, and then Wednesdays will be a remote day for students, and that will allow us to do deep cleaning and things of that nature. It was a very difficult decision to be made. A lot of information was presented to the Board of Education, and today I really wanted Mrs. Wisnett to be here with us to talk to us about some of the data that has been being collected in Alexander County and some of the advice that she can give us to make this the safest transition possible. Welcome, Leanne.
Thank you for having me. And I certainly support the decision that the Board of Education made last night. I think our students will benefit from being back in school. And I think this is a great transition to do it in phases.
Yes.
And continue to monitor closely.
Yes.
And continue what you've already done. I commend the school system. You have done a marvelous job. We have not seen any linked cases. We have not seen outbreaks, so we are very pleased. The numbers have stayed very manageable. We've been in daily communication.
Yes.
So we commend your staff. I know it's not been easy.
Well, they've done a wonderful job, Leanne, and the school environment, even transitioning these younger children back to 4 days of face-to-face learning, the school environment still looks very different. Because the things that we plan to continue to do, we will certainly social distance as much as humanly possible. We will also require that everyone wear a cloth face covering. And we will also encourage hand washing all the time. And when students and staff are not able to wash hands, we have hand sanitizer available to them. Some other protocols that will continue to be in place, we will continue to have monitors on the buses that will be taking temperatures before children ever even get on a bus. And then we will have staff at the entrances of the school where they will take temperatures and that sort of thing before children ever even get out of cars or enter the building. So a couple of things I would ask that you talk about is talk about where we are currently in Alexander County with people that we have in quarantine, the number of confirmed COVID cases, and that sort of thing. So could you do that for us?
Be happy to. And you know this is a moving target, so just as sure as we record this now, it'll change before we leave. But currently we have 617 cumulative numbers. Lots of discussion about, when do we get to start over with our numbers? And we may not, certainly not in this year. So that's from the very beginning. It's been a long time building. 617 confirmed cases. We have had 8 deaths. We send our condolences to those families. Tragedy in each and every one. We currently have 3 hospitalized. We have 73 quarantined currently. Over 500 have recovered.
Good.
And let me talk just a minute about our data for just school. Since school, I think we're 8 weeks or a little better than when school started back.
Actually, the first 9 weeks will end this Friday.
So we're at 9 weeks.
In just a couple of days, we'll have 9 weeks of school behind us.
Wow. It's went quick for me. I don't know about you and
your
staff.
Well, some days were quicker than others.
That's true. But we've tracked this since school has started, and we have seen 18 students positive throughout pre-K through high school. So then that's scattered all across those grades, and we've had 10 staff. We have seen only 1 linked case with staff. We have seen no linked cases between students, and I think that goes back to your face mask, your distance, everything you're implementing proves that obviously it's working.
Something's working for us to have that few cases.
And you know what that means when I say linked cases? It means that we can't track I might give it to you. That's a linked case where we have a student at school gave it to the child sitting next to them. We've had none of that.
Right.
We've had a link between two staff members.
Okay.
And
And I would assume that they worked in close proximity with each other.
They did.
Okay.
They did.
Okay.
And that's what public health is doing, is that contact tracing.
Yes.
So that's our job. When we get the report, we contact. We've been encouraging people to make sure they talk to us and be very confident in telling us all of their contacts, everybody they've been around, because that's part of that decision-making of whether we quarantine, whether we test. And those decisions are made individually, depending on each individual situation. So I think the data shows that in 9 weeks, that's not a lot of cases. And these weren't coming from the school. These were coming from home, from family, from social events. They were cases from outside that were students here. So it was not the students contracting it at school. So I want to
Okay.
make sure that's clear.
Yes, good news.
It is, and several of these were asymptomatic, tested for various reasons, maybe because they were a contact to a family member.
Right.
Household contacts, we would test everybody.
Right.
So we found several that way that really were not sick. They were in that what we call asymptomatic,
Yes.
where they have COVID, they're probably contagious, or they would be somewhere through that incubation period.
Yes.
But they weren't sick, so they would not have ran a fever. They didn't feel bad, so they didn't know they needed to stay home.
Right.
So
And
that's where we're,
that's some of the mysteries with this particular virus, is that people can be asymptomatic.
They can.
And so it's just very hard to detect sometimes.
it is, and especially the school age population. Often they're asymptomatic because they're healthy, they're young, they have
Yes.
great immune systems.
Yes.
So, and they're not being very sick. Even the ones that have some symptoms are not sick.
Yes.
So we've had no deaths in the student population,
goodness.
ages,
Yes.
and really, our deaths have been people that have had underlying health conditions. A lot of these were very frail to start with.
Oh, goodness.
So that's where we are. And we're still less than, the state's trying to get to 5% or less, and we're still not at 2%. So we are very blessed. I was on a call this morning with other counties, and even Catawba and some of our counties adjoining us, their data is, their numbers are much higher than ours. So we commend our population for our citizens doing a good job with the 3 W's.
Yes, yes. All right. Something else that I want us to discuss today, Leanne. I took my flu shot last week.
I got mine today.
Yay, yay. I want to talk a little bit about a conversation that you and I had last week, right after I had my flu shot, and that is some of the flu symptoms mirror COVID-19 symptoms. And the importance this year, it's possibly the most important time ever to be vaccinated with the flu vaccine. Would you talk just a little bit about that and some of what will happen moving forward when we're not sure if the symptoms are COVID or flu, and why it is so critical that we have students, staff, and parents vaccinated this year for the flu?
Yes, I encourage everyone to get their flu vaccine because the symptoms do mirror. Both have fever, aches, pains, runny nose, cough. I mean, they're the same mirrored symptoms. So what we will do, and most medical providers, when someone is running fever or feeling ill, they will test for all, and even strep. We have started to see stomach viruses going around and strep. So by being vaccinated from flu and preventing some of those flu cases, hopefully we will stay healthier and not have confusion. I sure wouldn't want to have flu and COVID at the same time.
Oh, my
That would be a
goodness.
very, very sick person. So, and I know we think about older people having the flu vaccine and, they're the most at risk, but we all need a flu vaccine. They make flu vaccine for infants. So I encourage everyone, unless there's a risk factor that your doctor knows about and tells you not to take a vaccine, we encourage that. This year, more than ever, it's important because we will be very proactive and very cautious. So if you have someone with symptoms, we're going to send them home. You know, if you have someone with fever, they're going to go home while their medical provider tries to figure out what's going on. And we hope it's none of the above. If I had to pick, I guess I'd take either strep throat or a stomach bug. But, and, you know, we hear a lot about COVID vaccine, but I'm not sure that's going to be soon. I don't think for the general public that will be any time in this flu season. So we're certainly preparing for vaccinations, but it will be limited at first, and that first people will be healthcare providers and your frontline staff. So your students will be the last to be vaccinated.
Well, Leanne, last night, it's funny that you said something about the COVID vaccine. Last night, we actually had a distinguished professor from Duke University School of Medicine. He participated in our Board of Education meeting, and he joined us via Zoom. And part of what he talked about was the COVID vaccine. And what he shared was that really by the time that it trickles down to students, it could be as late as the year 2022. So that's
sure
really that's really a long time, especially when I hear people say, well, a vaccine will be available in December or January. I just don't want us to hang our hats on that. So thank you for the information about the flu vaccine. I know that I have talked to some people, and the statement has been made, well, Jennifer, I've never taken the flu vaccine because I don't want to get the flu. You are in the medical field, and I want you to talk about the flu vaccine cannot give you the flu because it is not a live virus.
Correct.
Would you talk about that just in case somebody is fearful that if they take the vaccine, that automatically puts them at risk to get the flu?
Certainly. Yes, the flu, you're exactly right. I'm impressed with your medical knowledge.
Oh, listen, I'm not that kind of doctor, and I tell my family that all the time. My doctorate's in education, not in science or medicine.
Well, you're very knowledgeable. It is not a live vaccine. There is no way it can give you the flu. Now, that doesn't mean you weren't becoming ill with something before you took it. You know, I think that's where that misconception comes from. People maybe, you know, a lot of times you start your day out and you're fine, and then quickly, wow, I don't feel so great. I've got a headache. I don't feel great. Well, you may have went to the doctor and got your flu vaccine this morning or yesterday. It's just coincidental that you became ill. The vaccine did not give you the flu. It is a dead vaccine. So, doesn't mean you couldn't have got a cold or lots of other things, but, and generally most people don't even have a sore arm, don't even know they have had it. So I've taken mine every year for the last 30 years and will continue to.
So have I, and I will continue to. The next thing I want you to talk a little bit about, last night when I made the presentation to the Board of Education, I talked about how limited we are with substitutes and things of that nature. And I would like for you to talk about what is a cluster, because I know that is the terminology that has been used with COVID-19. Mm-hmm. And you and I made an agreement a long time ago that we would communicate routinely, and we do that. But what kind of decisions I might be faced with in the event that we have a cluster in a school, in multiple schools, or whatever the case may be. Would you talk a little bit about what is defined as a cluster?
Certainly. You hear a cluster, you hear if there's 5 cases at a time in a location. But those, you've got to realize those have to be linked. They have to be clustered together and related. If we have 5 cases, but there is a case in one of 5 different schools, that is not a cluster. So we are looking for that group that are interconnected. Maybe we had 5 in a classroom. That would warrant a cluster, and we would discuss that. I don't want at this point to say we would close that classroom or that school, but we would notify anyone that was exposed. And that's what public health does, is investigate. We do contact tracing, and we let anyone that has any potential to be exposed know that, because that's how you stop cases, is to quarantine, keep people at home during that period when they may not be sick, but they may be incubating it. They may be contagious and not sick yet. So that's where we would get into a cluster. And you and I would be having conversations, and we have conversations with your nursing staff that is working so hard daily. They're doing a great job monitoring. And if in doubt, we err on caution.
Yes, absolutely. I just want to stress that as we make this transition to, it's called, I guess, Plan A for our pre-K through second grade students, that we cannot become complacent with any of the measures that we have been taking thus far. And that is, checking for symptoms, that contact tracing, wearing masks, washing hands, social distancing. We have to really stay on top of that because we've had wonderful results thus far, and that is what I want to continue. Leanne, I know that we have some unrest about the safest way to bring more children into our buildings more days each week. Is there anything else that you might offer us as far as any kind of safety measures, or anything you would like to stress today as we work to get ready for those students to come back on October 26th?
I think just to continue what you're doing. I think we've got great plans. We've discussed them many times. And I do think these plans may really benefit us with the other germs and viruses that we normally see this time of year.
Yes.
So, we have done such a great job with hand washing and cleaning. And, generally when we get into winter, we have those bugs and viruses. So we will already be doing that to prevent those as well. So I think we're at a great place to move forward. And I know the students are excited to come back. And, what we're hearing and seeing is lots of anxiety and depression. And even in our students and adults and seniors as well is, they want to be back in class. They want to be more social. And I think we can do that by continuing these practices. And we can't get complacent. We can't just, we made the comment, we were on the radio earlier, Billy Walker and I, and she made the comment that we're getting COVID tired. We've got to really be cognizant of that and pay attention and wear our masks, not get complacent.
No.
And because that's what's going to keep us well, is to continue those practices. And I know it's hard. I know the masks are challenging, and it's hard to remember always, but your students have done great. The students have really, they have adapted really well.
Yes.
I've been very proud of them.
I have too. Just to recap for the community, as I said, pre-K through second grade students will be returning 4 days each week to our classrooms beginning October 26th. Our Board of Education will meet again on November 10th for their monthly meeting. At that time, I will report how things have gone with that transition, and if we are ready, there is talk that the students in grades 3 through 5 then will transition to the same schedule beginning November 16th. So fingers crossed that all goes well. And Leanne, I just thank you for the resource and support that you continue to be for the Alexander County school system. And I just thank you for everything.
Well, we thank you we've always been great partners.
Yes,
it's a great community.
It is. It is. We're very blessed. Thank you. Have a great day.